Today is the 7th of June, and I know I just recorded yesterday, but I feel like I need to record again because I thought of something I forgot to say in the other video. And then also, I bathed. Yay, my hair is not filled with grease anymore, right? That's awesome. Um, so, let me tell you, that sponge thing that had to come off, it was creating like a constant compression on my thigh. And after, the doctor's office and stuff, they had wrapped everything up. Yes, the ace bandage would pop open and it was a pain in the butt, but the compression was mostly still there. When we took everything off of the thigh so that I could take a shower, first of all, it's really gross. It is. It's really gross. But secondly, no compression on the thigh. The pain was absolutely a 10. Like, it was all the way. It felt like my leg was pressed against a hot burner on the stove and I could not get it off of the burner. And I cannot express how bad the pain was. I ended up at first trying to stand in the shower, but I was in so much pain that I ended up trying to sit on the ledge, and that didn't work either, and I was like passing out from pain. My roommate was right there because we're basically brother and sister. We've seen each other naked, like, it's not a big deal. So she was trying to help me with showering, and she was like, I would rather get an IUD put in me again because it was really painful for her when hers got inserted. She was like, I would rather do that than be doing this with you right now. Like, I feel like I'm hurting you. And I'm like, it's not you hurting me, it's that I'm in pain. And I ended up on the basin of the tub, like literally almost passing out from how painful it was. It was excruciating. Like, I'm very relieved to be clean. I know it was necessary. I know it's good. Kill them germs. Wonderful to hypocleanse and kill the germs. But at the same time, even after a week of not bathing and being smelly and being so excited to bathe, I did not dread the pain enough. So I want to make really clear to anyone who's getting phalloplasty, I, up until this point, had not experienced the pain of the thigh in the way that other people had described to me the pain of the thigh would be. And I had experienced some burning, and there was a strip of it that burned, but most of it was numb. Like, my whole leg was numb after anesthesiology put the block on it, right? So I didn't experience that. And then the whole time I was laying here, it was all compressed down with that sponge casing thing, right? And when I went to this appointment, they took that off and then they immediately sealed it up. Well, my arm, they were taking the vacuum seal stuff off, and so I was in pain from that. And so I might have just missed the burning from the thigh because they were doing both of them at the same time to try to decrease how long I was suffering. And it was just all pain, right? So I was just in pain and not really very conscious, capable of thinking with my, smart brain. It was all nervous system surviving. And when I took a shower yesterday, it was back to nervous system surviving. Like, it was bad. And I am I felt so pathetic because I couldn't do anything for myself. I was in so much pain, I couldn't even, like, wipe soap on myself right. Like, I would try to, and it was just, like, pathetic. And I felt so deeply, like, ashamed. And at the same time, the pain would just not stop. So, um, very traumatic bonding moment for my roommate and I. Um, she was like, "I'm so sorry for when I've yelled at you before. I'm so sorry for." She was like, "We're gonna have dinner and I'm gonna make peas and asparagus because my favorite vegetables, my top three favorite vegetables are probably Brussels sprouts, peas, and asparagus. And then after that, it's probably like bok choy. And anyway, the point is she was like, "Oh, I'm gonna make your favorite foods," and she was telling me how cheesy she was gonna make it and stuff. She was trying everything she could think of, and she was like, "Your face is so pale." Like I was literally like trying not to pass out from how much pain I was in. I have been only taking 5 milligrams of the oxycodone because I have a fear of getting addicted, and I took 10 yesterday, and it was I had taken 5, and when we started doing all of that and everything and stuff, I was like, I need another one. There's no way. So, just putting that out there that when the compression comes off the leg and it's just your wound open to air or water or whatever, it burns so bad. It literally feels like it's on fire. And it's not fun. So just putting that out there. Thankfully, we slathered all this white stuff on there and everything. It's got to stay on there for all of today and everything. So I will not be bathing again till tomorrow, and I don't have to do it again today. I will say my arm, on the plus side, it didn't hurt. Like putting hot water on it and things like that. Even where like the stitches were, that was fine. My phallus, same thing. Even on the bottom part where the new skin is, did not hurt. My skin being so intact, seems to be that it acts like skin. And it doesn't look quite the same as the rest of my skin. It definitely looks like it's still like healing skin. But like as far as water goes, it was fine. At first we tried to use the detachable shower head to spray water only on like say my upper arm and let water dribble down onto it, but it really didn't hurt. So she put on like a mister setting on the detachable shower head, like where it sprays more gently instead of hard, and put it it touched my arm where the where the bandages are, underneath of it where the new skin is and stuff, and it didn't bother me, it didn't affect me, like it was fine. So yay. And again, that was for the bottom of the phallus as well. The thigh, we got to a point where, again, the nurse said, "Oh, you've got to do this like 3 or 4 times before you put this white stuff on." It would be like me being like, "Okay," and then I would hold my breath. She would get a little water on it, and I'd be like, "Okay, I can't," and she'd pull it off again. Like it was bad for the thigh. But again, the thigh feels like it's on fire, like literally being burned, and then you put warm water on that, and it's just it was not fun, very not fun. We wrapped it back up. She put the white frosting looking stuff on it, and then sealed it up with the bandaging, and the gauze that we're supposed to, and then no ace bandage because it got here, the leg brace thing. So this is what it is. So it has lots of space for blood flow to still flow by the phallus, but it has these straps that wrap around the thigh and create compression so that I don't have to use ace bandages for that. Also, the torso part of it is just high enough that it's not hitting the scars from my groinal surgeries and stuff. And so that works out really, really well. So it got here yesterday, and let me tell you, when she wrapped that thing around my thigh and velcroed the straps, the 3 straps on it, I literally almost started crying at the relief. It hurt still, believe me, it was still hurting, but the degree of pain went down like 3 notches. I was like, holy crap. It is slightly hard to walk with because I've got I've got the phallus palace going on, and then I've got this leg brace thing, and I'm supposed to keep my leg semi-straight, but the brace is on the leg that I'm supposed to try to keep semi-straight. And so it makes things slightly weird walking because basically there's a bunch of bulk of cloth and stuff right there, just like, I don't know, impacting each other. So that's kind of annoying, but it's worth it. And the coverings, like over the thigh and up to the strap on the torso, it's underneath of the mesh underwear so that I can go to the bathroom and stuff like that. So the mesh underwear sometimes catches on the Velcro and it tries to Velcro itself to it, but it's a mild annoyance. Like it's totally worth it. I already am like, this was worth the $22 or whatever this was. And I have to wear this thing for another, 2.5 weeks. And literally from the very first moment it got put on me, it was worth the money. So I highly, highly recommend to anyone getting phalloplasty, whichever leg is going to be your donor site, get one of these in advance, have it ready so that when you do your skin graft surgery, you can just use it. It's worth it. It's completely worth the money. I would say of all the things that I have for the phalloplasty, this is one of the best purchases because the compression on the thigh just reduces the pain and it reduces the bleeding. The bleeding's almost nil. There's almost no bleeding now. And I don't have to worry about this stuff slipping and sliding as much. I've had to adjust it just slightly, like about this much, one time since having this thing put on me. And with the ace bandages, I was having to deal with stuff sliding like every couple of hours. So cannot recommend enough. If you're getting phalloplasty ever, get something like this. But make sure it has that gap there for there being enough space for the phallus. You don't want one that just goes straight down. You want one that has a nice wide space like that. So that the phallus is still getting all the blood flow it needs to get while it's still sitting up. And man, I cannot say enough. Get it. I have this wedge pillow here. It's like a mastectomy pillow or something like that. And it velcros into different shapes. So like right now, it's a triangle, but it's a triangle that's more sloped down. Whereas for top surgery, when I very first bought this pillow, I had it in a triangle where I was sitting like upright, but I could like lean against it a lot. And I cannot recommend enough a wedge pillow as well. Like it makes such a huge difference. Now I do have this towel over it that we switch out so that my sweat and stuff doesn't get on it. But like it has this Velcro-y pillow thing on it too to lean your head against. And again, on the sides are these Velcro-y spots so you can change the shape of the triangle. And the little pillow thing can move on the triangle where your head's going to be. So it's really, really nice. Can't say enough. A wedge pillow and this leg thing here, super great to have. And then a detachable shower head. We use a lot of baby wipies. Again, I think I've said this before, but just to say it again, go to Costco and get the big box of baby wipes. It's been perfect. I have 2.5 weeks left, and there's 2 things of baby wipes left. And I'm like, somehow it's the exact right amount of baby wipes. Because you need to use them when you go to the bathroom. Because you can't just use toilet paper. You have to actually, be, sanitary as possible. Which means you need to use baby wipes of some sort of wipies to kill as much germs and bacteria and stuff as possible to keep the wounds as clean as possible. The other thing is the baby wipies work really well for cleaning up blood along the edges of wounds and things like that and stuff. And also when you can't bathe, you can at least wipe your underarms and your face and things like that with baby wipies, and it's like sponge bathing, but it helps a lot. Another thing that I would say is like a really solid thing to have for a lot of things is one of those long claw grippy thingies. Um, that's pretty helpful. Um, for my physical therapy, I haven't done too much with my hand pressy things yet. I've done some exercises with them, but I'm going to be doing a lot. So having those exercise things where you grip or stress balls, both of those is good for physical therapy. And then, well, okay, I can't grab it with this hand, but I don't know if you can see it right there, but I have a back scratcher is really helpful because you can't reach to scratch down on your leg or something like that if you're itchy. Like, your one hand is not going to reach everything, especially because you can't bend over. You're not allowed to be in a sitting position. So having a back scratcher like that, like a long one, really helps. And we do have a bidet, but I haven't actually used it as much as I thought I was going to. I used it a lot more with my other surgeries than this one. I think because, there's so much that I have to keep clean with the baby wipies anyway. So I think that must be why. Because with my other two surgeries, I used the bidet a lot more than I am with this one. But it's still nice to have. It still helps. Um, I'm not on a reduced starch diet anymore. So my carbs have no limits anymore or anything like that, like I was up until that appointment. I think I forgot to say, oh, starting from that appointment, I don't have to do that anymore. Also, my psychologist had basically given me a time limit on when I was allowed to go out and see friends and do stuff. And essentially, I talked to her because of the appointment that they're taking a week off from how long it'll be till I can sit. So my arm and my leg still will be going for longer, but my phallus and the little hole on my belly, those a week, after a week from the appointment. So on Friday will be the last day that I need to be bedridden. Friday will be the last day that I need to worry about maybe putting little gauze in that little hole, and I can start putting a band-aid on it. And so I was like, I really think, that should bring down when I can start going out and doing things. And so she said that that's probably true, especially because I've been so isolated in this room, and my roommate and I probably need a little bit of a break from each other because she keeps losing her patience. And I I feel so frustrated because I want to just be able to get up and do things to make things easier and less complicated and less hard. And so the goal is that I will probably be able to go to commencement and see my friends and stuff as long as someone will guarantee to be my ride and to be with me. And I'll be allowed to sit at that point. And even if I need to sit way up high and lift my phallus up a little bit, at least I can go. That is probably what's going to happen. And then also, I can take a walk on the beach. No kayaking yet or something like that, even though that's what I want so bad, but I have to wait for the kayaking. But at least I could go for a walk by the waterfront, and I'm really excited for that. And also, I promised to take my roommate out to eat, at a nice restaurant that she really likes. And I decided to just go all out and take her to her favorite restaurant, even though it's really expensive. It's like very, very, very expensive. But also, I feel like she and I have been through like an ordeal, and this has been a lot. And not only do we deserve it, but also, I mean, the food's super good. And I'm like, I'm gonna get two desserts because it's not just we survived this big horribleness, but also it's celebration. Like, I have some disappointments about some things, but in reality, I have genitals and maybe it's not fully completed genitals, and maybe it doesn't look exactly like genitals yet, but I have genitals. Like, something. Something is started, and that's worth celebrating. I've waited my whole freaking life. So I'm like, screw it. Let's go spend hundreds of dollars at a restaurant and eat like kings for one night and celebrate not only that I will never have to have this particular part of surgery ever again, and that I can start losing weight after that and all that kind of thing. Life will be less to dread because all my surgeries going forward will never be quite this horrific or quite this much wound care or quite this much struggle. Like, they'll probably be more like the previous surgeries where it just was not as bad as this. But I knew going into it that this one was going to be hard. And it feels like something we're celebrating. Not just the overcoming of the agony of taking a shower with your leg on fire, but also, like, months of recovery and all this crap. But, like, in reality, it feels like it's worth celebrating, even if it's not ideal, that I have actually got some sort of, I mean, it's a funky one, but I have a penis. I don't have balls yet, and I everything looks strange down there, and I can't pee out of it yet because of these fistulas, but it's there, and I cannot explain or express the relief that it is for my brain that it's even there. And in a couple of weeks, I'm gonna be able to have my arm and my thigh be happy and start exercising for reals. Oh my goodness, there's a lot to celebrate. So I think having something to look forward to is important, and so that's something to look forward to, and try to be less disappointed. I I was talking with my psychologist about feeling like I was missing out on opportunities, and I could see these, ceremonies and stuff, and like this upcoming week is gonna be when the publishing party is for, something where something I got published is part of it, and they wanted everyone to come read their writings in front of everyone, and I would have loved to have done that. That would have been very fun for me, and I'm not going to be able to go. And, there's this past week was a bunch of award ceremony things that I should have been part of, but I couldn't go. And I keep thinking about submission dates for papers when they'll be due for conferences, but will I even be able to go to the conference? And, like, I don't know, because I don't know timelines of things, and it's like, am I messing up my whole momentum for my career and stuff? Even worse, and she was like, what's your top priority? And I'm like, well, obviously the phallus is the top priority, but I wish I could do both. And she's like, well, that's unreasonable. So if you had to pick one, which one would you pick? I'm like, okay, well, couldn't I still somehow do both? And she's like, you're human. Anyone wouldn't be able to do both. You have to be realistic. So if you can only pick one, which one would you pick? And so I've been trying to hold on to that it's true. I would pick my physical body. I would pick the hope that possibly the rest of my life doesn't have to be as miserable as my life has been up to this point. I would pick that over my career. And I really, really want to be able to do both. But if I have to choose, and that's the choice, then that's what I would choose. And here I had already in my first quarter gotten accepted into the grad program at the university. And I'm going to have a pretty long delay on my bachelor's program, and I don't know if they're going to change their mind about that or be like, oh, you're taking too long. I don't know what's going to happen with my financial aid, because financial aid lasts for, what, 6 years? And it's been 3, so I don't know how long this is all going to drag out, and if I'm going to run out of financial aid or something. I don't know. Like, I'm on merit scholarships, and are they going to be impacted? I don't know. Like, if I take a year off from going to conferences because I literally just have all this medical crap going on, is everyone going to forget I even existed? I don't know. At the last conference I presented at, they said I was the future of philosophy. Like, in front of everybody. At the conference before that one, they gave me the graduate student pedagogical certificate, even though I'm an undergrad. I'm only the second undergrad to ever get it. From the Society of Ethics Across the Curriculum. Society for Ethics Across the Curriculum. Like, I was supposed to present at a conference in May, but I was like, there's no way I'll be in recovery, so I had to decline that one, and that felt horrible. And here I am looking at these paper deadlines, and I would love to go to the conferences and present, and I would love to start working on the paper that I had already started the research for. Plus, I've been thinking a lot about the next paper I want to write, and I'm very, very interested in creating new iterations of these things, and yet I only have one hand, and dictation misspells like everything. It feels so scary to not know what's going to happen with college and with my degrees and my career and stuff. It does. It feels so scary to be doing all this stupid medical stuff while I'm trying to go to college and I'm trying to have a future. But I cannot imagine any future, even if I somehow had, like, a spectacular career and I went down in the annals of history as one of the greatest philosophers who ever lived, and I changed the world and all the financial systems and blah, blah, blah. Even if that somehow happened, which, I mean, that's not very realistic. But, even if it did, if I didn't have genitals, I can't even imagine any of that. How could I ever have enough weight off the back of my mind to pursue any of that? Like, how could I ever actually fully commit myself to pursuing those kinds of changes, like, destroy oppressive financial systems and make it so that the world's a better place, when I'm so still trapped within my own self with the shame and the body that I constantly try to dissociate from. Like, how can someone ever be at their best or give their best or do their best, no matter how much I try to do my best and be the best person that I can, when you're constantly bogged down with this amount of shame? So I feel like it has to be that I would choose the phallus. It has to be that I would choose surgery. It has to be, if it's a choice between the two, and I couldn't have both, I would still choose this. And maybe that seems selfish, because I really do want to help people, and I really do want to help the world be a better place. But I just can't do enough when I don't feel like I can fully exist. I just want to be allowed to exist. And the only path to that for me is going through all these surgeries. So unfortunately, I have to miss out on opportunities whether I want to or not. And Um, I love presenting at conferences, and I love writing papers, and I love getting published. I genuinely love helping people so much. I miss being around people. I miss helping with events. I miss managing events and doing my job with the Title III, you know, grant and helping students to get financial aid and access to scholarships and like helping them on their educational journeys and being able to afford it without student loans and getting access to food and clothes and resources. Like, I miss doing all that stuff so much. I really, really do. I miss the LGBT plus folks that I try to be supportive of and caring towards, and I miss trying to help people. But right now, I gotta help myself. And helping myself will hopefully open up more possibilities for helping people because I would be able to do it at a better capacity. But even if that's not true, even if it turns out, no, this just was my capacity the whole time, and, I took a break from helping people only to come back and help people at the same rate, the pause would still be worth it because it helps me so much. And so I choose to lay here, and I choose to focus on my health, and I choose to focus on my body and on undoing the horror of what was done to me when I was little. And finally, for the first time in my life, having genitals. Finally, I'm starting to be a real boy, like, looks wise, and not just internally. My insides are mostly male. My hormones are mostly male. I guess externally I do have a beard. But it's not my fault that people cut me when I was little and surgically altered me. And the repercussions of that have just been horrible my whole life. And I just can't live all of my life stuck that way. I just can't. I just can't. And I have no idea how long I'll be able to live once all these surgeries are done and feel more like complete. But I know every single year will be precious to me. So if I have to choose between the two, I choose this. Even though I don't want to have to choose. I don't want to have to choose at all. I want to somehow do both. But there's a lot of things in my life I have wanted that I did not get. That seems to just kind of be life. But I'm a trier. I try anyway. I try my best. Anywho, if anybody ever chooses to go through all these surgical processes and stuff, now that I've had, multiple surgeries and stuff, I would definitely say top surgery is the smell from not being able to wear deodorant is pretty awful, but it's actually the easiest surgery in a lot of ways. It's really not too bad. The other, so If you're just getting like a hysterectomy or something, maybe it would be less hard. I got a hysterectomy with a vaginectomy with an udinectomy or whatever they were. I never had the proper parts in the first place. Like, so my situation was different because I had no functional reproductive parts, period, whether they were male or female. And they pulled out, unfortunately, my shriveled up little gonady, but they also pulled out like all of the completely non functional female parts too. So, there's that. But on top of that, I had the endometriosis that was so bad and eating into my organs and shit. So they had to cut out like a big hollow in my tummy, and all my other organs fall into that and settle and everything. So I don't know if that's a fair assessment that top surgery is the easiest one. If, someone maybe wouldn't be in the same situation that I was because of being born intersex, my insides are just weird. Um, just underdevelopment issues, period. My insides are just weird. Like, I have that super rare anemia that makes every blood draw and every IV a giant pain in the butt. I have, these pupils that don't undilate, they just stay big. I don't age I age like molasses. Like, I don't even have forehead wrinkles yet. How is that possible? My roommate has forehead wrinkles, and she's in her late 20s. Where are my forehead wrinkles? I just don't age very fast at all. But I'm also very short, and I have more nerves on one side of my body than the other. I'm just weird inside. The point is I don't know if someone else might have an easier time with something like a hysterectomy or something than I did, or a vaginectomy or something than I did. And, I made videos for all those surgeries, so if someone wants to go back and learn about those surgeries and what that was like and all those kinds of things, you can. The whole list is here. I way back, and I mean, this is what, almost 200 episodes of this journey. Crazy. Can't even believe it. And most of the time it has been only one episode a month, the majority of the time, except when I have like surgeries or I have like, I don't know, major things happen in the world. Like, for instance, what was it, Oklahoma, that just made it so all gender affirming care is illegal no matter what age. Grown adults, personally, I'm not against gender affirming care for minors because it would have been life changing for me. Let me tell you, it would have been. But technically, most intersex kids do not show gender markers until after puberty. So it's good for them to go through puberty, so they can get a sense of themselves, what gender they are, and also their sex characteristics actually develop, which is part of why it's so absurd that doctors consider standard practice to cut the baby, the toddler, because their sex characteristics haven't even grown yet. So it's very frustrating. But on the other hand, man, when I was a teenager, I was so messed up. And part of it, yes, was abuse and living in abject poverty and having health issues I didn't know what was from, and being bullied all the time. And there were so many things wrong when I was a teenager. But part of it very much was giant lamentations in my journals that I can go read because I kept journals. And it's just like so obvious that I was so confused why I wasn't a boy. And it would have helped tremendously. So I'm not against gender affirming care for minors, because some of us, we've known since we were a toddler. I remember being 3 years old and being like, why don't I look like my brothers? It was very confusing for me. I never understood why I wasn't a boy. That said, even if they wanted to be like, oh, well, they're kids, they don't know what they want yet, whatever, wait until they're an adult. Gender affirming care, denying it to grown ass adults who can make decisions for themselves and decide for themselves is a like crazy to me. Like, you'll let people go get a boob job, you'll go let a guy change his jawline, you'll like, how is that not all gender affirming care as well? Like, it's mind-boggling to me that they could say, "Oh, let's just outlaw people getting surgeries to make themselves feel better about themselves," because that's literally what they're doing. Um, if say, you know, it's not a boob job for like just wanting it to be bigger, and it's like a mastectomy, and then they wanted to get breasts afterward or something. Like, how far down the rabbit hole do you have to go before you're like, you know what? You're right. This is absurd. You're an adult. We should be allowing you to make decisions for yourselves. This is to the point of brutal. Like, this is the point of no kindness. Like, maybe they're like, oh, a nose job, that's not really a big deal. Sure, we don't care about outlawing all gender affirming care because your nose job's not important. Well, what about the person who used to weigh 400 plus pounds? They lost a ton of weight and now they have the skin sagging off of them everywhere, and they would like to get surgery to adjust that sagging skin and make themselves feel better and look better and be comfortable with themselves. Gender affirming surgery is not just transition. And they want to treat it like it is, but it's not. And they're grown adults with adult decision making skills. If an 18-year-old can sign up for the freaking military to go die, an 18-year-old can decide for themselves if they want to start pursuing some surgeries. If an 18-year-old is allowed to drive when the rates of car accidents is as high as they are, if an 18-year-old can be tried in court, if an 18-year-old can vote, what in the world are you doing denying grown adults the ability to get surgeries? Don't agree with it at all. Like, even if you said, oh, a kid needs to wait until they're an adult, not that I necessarily am against kids getting gender affirming care, but you still technically have some sort of an argument in that when we're younger, we don't always make sometimes we make decisions we regret when we're younger. I definitely did some really stupid things when I was younger, and I definitely wish I could go back in time when I was younger and undo a couple of things, for sure. None of them have to do with my body, gender stuff, but there's definitely some things that were pretty stupid, that I did when I was a teenager. But, once someone's an adult, they should be making their own decisions. That is not fathomable to me, to outlaw gender affirming care of any kind for anyone, no matter the age. They're adults. Like, even if you want to say, oh, they have to wait till 21, like, with drinking, I would still say that's stupid. But at least there's some semblance of an argument that they could attempt to make. But they're saying anyone of any age. A 65-year-old who's been wishing their body was different their entire life wants to go get surgery and have their body be different. And they're like, nope, no, you're not aware of yourself enough. Your doctors are not educated enough for you to go do that. That's so dumb. That's just ridiculously stupid. So, yeah. I am just mind boggled by the sheer volume of other people trying to control other people. Like, you can't control other people. That's not okay. There's a difference between trying to keep someone from, like, doing harm to someone, like, say, robbing someone or, murdering someone, something like that. There's a difference between that and trying to deny someone their right to do something that they want to do for themselves. And you could say something like smoking, their secondhand smoke. So they shouldn't be doing that because it can hurt other people. You could make some sort of an argument like that. But with surgery for your own body, it doesn't hurt anyone else. It doesn't do anything to anyone else. And it might just actually be beneficial for the person who's getting the surgery. And they are the ones who can decide that. They are the ones who can pick that. There is no amount of burning in my leg and almost passing out because it hurts so bad that undoes how much of a joy it brings me to have a phallus. Totally worth it. Completely worth it. I'm an adult. I can decide for myself what I want for my own body. So, this controlling thing that's going on in certain states and stuff like that, it's just so convoluted and makes no logical sense in reality. I don't know how this stuff gets passed because it's so stupid. It's just nonsense. Let adults be adults and choose for themselves what they want for themselves. If they want that, doesn't affect literally anyone but them. So leave them alone. Let them do it. They're an adult. Anywho, sorry, I went a little off tangent there, but like sometimes the world is just so backwards. Anywho, here I said this video would be shorter. And then I got off talking. ADHD moment. Sorry. Anyway, there you go. That's it for today. Bye.